I'm Kazem Rahimi. I'm going to give my perspective on the research on safety or health and cities. My background is epidemiology. I'm a cardiologist, so please bear with me, so I may give you sort of a different perspective. So the focus of what I'm going to talk about is the program that Michael Keys and others in the room we are about to embark on called Peak Urban, and from our perspective the focus will be obviously on health. But to give an overview of what the program overall is aiming to achieve, this is a very large program funded by GCRF that aims to look at, to build skill capacity for decision making on urban futures. One's by generating new research grounded in the logic of urban complexity, and in parallel to doing research is also, the second aim is to foster new leaders that draw on different disciplinary perspectives to address challenges found in the 21st century city. And the collaboration includes a number of partners in Oxford, anthropology with Michael Keith, population health, that is us, the Mathematical Institute, geography, and then the international partners, the Peking University, University of Cape Town, Indian Institute for Human Settlements, and in Columbia DFT University. So each of these partners will look at the problem of cities from their own perspective, tackling issues from migration over to transport, over to economic development. But our focus will be on health, working with colleagues across the world. And what is the sort of the challenge that we want to tackle? Obviously, to many of you is quite clear that our postal codes have got more to tell about our health status than our genes. Being a medical person myself, that notion tends to get a lot of the time forgotten. So we tend to focus more on the biological, more proximal risk factors of the individual and forget about how our environment shapes our future. And not only that this is a determinant of illness, but also it has a lot of opportunities, offers a lot of opportunities for changing the trajectories of people's health. And when we think about health and environment, a lot of the time we tend to think about injuries and things that are immediately affecting our health. But if you look at the low and middle income countries as well as high middle income countries, the burden of non-communicable diseases is growing. So the silent killer. And here on this slide, the study that was recently done looks at the sort of a proportion of the burden of disease from several conditions. Some of the most important conditions, stroke, ischemic heart disease, diarrhea, and so on. There's a fraction of that is attributable to environment. And this is, even for those chronic conditions, it tends to go in the range of over a third of it. There are important diseases that affect a vast number of populations across the world, and unfortunately, those in low socioeconomic status are more likely to be affected by it. And there are modifiable through change in our environment. But what the challenge is that the information to local decision makers about things that could be or should be modified are not accessible, or they are not available in the right granularity or timeliness so that they understand what the implications of their choices are. I mean, if you're in a city hall and someone would ask you how many people are actually dying of stroke because of environmental factors in your city, you wouldn't know. So a lot of the data that we have, a lot of information that we have tends to be sort of at the level and collected from a time period, and that makes decision making at the local level quite challenging. But what we know is obviously, in order to induce change, having access to information and having the feedback loop that is timely is going to be quite important. So what we're trying to do is quite an ambitious program where we're trying to bring in a range of data from global to local and build a planetary urban health map that allows sharing that information with decision makers. I mean, there was a discussion about technology. Our focus here is, obviously using the multidisciplinary capacity that the network brings with different perspectives on it. But through a combination of data and technologies can be defined very widely. What we mean by that are mainly methods to make sense of the data. Those methods could be qualitative and quantitative, but in the focus of our work is largely quantitative analysis. So how it's going to look like is, something like this, that we will have scanty data, some of it being macro level data across the globe, some of them being micro level data for local settings, some of them having information about health status, some of them having information about the environment. And through interdisciplinary work, we link them together and trying to just fill the gaps in our knowledge for certain places. And that information can, in the first instance, just be shared as a platform to go to stakeholders who want to have that information, to whom that might be useful in terms of changing the decision making. But as a research, that could also become a platform for investigating and refining what is the impact of environmental risk factors on various health outcomes. And moving on, the same information could be used to create what-if scenarios. What would be the impact of, let's say, changing the built environment to that extent? How much an effect could it have on health? I mean, this is the more challenging bits of it that would be coming at a later stage. But that would make directly the consequence of decision-making more visible. And to just give some examples of the work that other people have done and some of it we have been doing, how that could become useful. I mean, let's look at the question of air pollution. Here on the left-hand side, a study that combines, global information from satellites about pollution, combines it with very local information on monitors that have got high resolution, and through simulation can actually predict what is the exact level of air pollution with high resolution in places where that information has not been collected in such way. On the right-hand side, another study, where the challenge to many decision makers is that, conducting local surveys is very costly and time-consuming, and by the time the results come out, they're outdated. Can one use information here about just the type of cars that drive through streets to predict the demography of a certain environment? I mean, you could replace car by walls, in a sense, any information that you have, but in that study they've shown that, that model is not scalable to every place, but that shows that using that information, analyzing data from millions of places, that the models can very accurately predict the demographic composition of that environment, and at the same time actually predict what is the age distribution and sex and how people have voted in previous elections. And that could become essentially a platform that could be used for some information collection and information processing. Another example of some of the work that we have done, I mean, we tend to take an approach in research where we look at one factor that is of interest to us and trying to just match it to another outcome that is of interest to us. I mean, the learning from that is obviously huge, but the challenge with that is that we don't discover things that we haven't thought about. But what we know is with access to these large data sets, and this is an example of using electronic health data sets, if we make use of the multi-dimension of the data and allow the model to tell us what are the things that are important, we are highly more likely to just get models that are more accurate in terms of classifying who's at risk of having certain outcome, in this case someone being admitted to hospital or not, and discover things that we didn't think ourselves is going to be of importance. So this was just a brief overview, and obviously we are at the beginning of it, and look forward to the discussions. I didn't mention the several limitations and challenges that this approach has. I mean, no approach is going to be perfect, and it won't tackle the major issues, but we hope that we will make an important contribution. Thank you. Thank you.